Hello, this is Angelia, and you are listening to or watching the podcast, Why You Do What You Do. The podcast that talks about human development and psychology, to help you figure out maybe a little bit more about why you do what you do. And last time, we were talking about aging and physical activity, and we're going to be taking up on that again. Unfortunately, the older U.S. adults get, the less they exercise. And like I said, if you watch any of my other stuff, my mother-in-law is going through that now. About 31% of 65 to 74-year-olds exercise moderately for 20 minutes at least 3 times a week. And 16% exercise moderately for 30 minutes 5 times a week. Only 13% in this age group exercise vigorously 3 times a week. And we all know we're supposed to be exercising, and it used to be back in the day, prior to us getting machines to do all our work, you and your husband probably could get enough exercise in your daily doings, but nowadays when we're sitting down and doing things, probably not so much. So, this is something you should be doing to take care of yourself. I'm limited to 15 minutes a day, Monday through Friday, plus I go out and walk around and stuff on, Saturday and sometimes Sunday. So, technically I'm getting mine in, but it's not in the form, that a lot of people can get it in. I can't go longer than that because I have osteoarthritis and, osteosclerosis in my pelvis. So, I can't go further than that or I start hurting myself. And, that's not good either. Activity levels are even lower for those 75 and over. About 28 to 34% of 65 to 74-year-olds and 35 to 44% of those 75 and older engage in no meaningful leisure time physical activity at all. And that's the old saying, if you don't use it, you lose it, and that's true. And some of our older folks, like to sit down a little too much, and they lose the ability to walk. Nutrition. Many older people do not eat as well as they should. And a lot of us don't anyway. Whether because of diminished senses of taste and smell, dental problems, difficulty in shopping and preparing food, or inadequate income. Many live by themselves and may not feel like fixing nourishing meals for one person. Studies have found evidence of malnutrition or specific dietary deficiencies in the diets of many elderly people, especially lack of zinc, vitamin E, magnesium, and calcium, and overconsumption of fats. And we're all kind of guilty of that, aren't we? Fats and sweets. I tried to take zinc. It made me sick. I do take vitamin E every day. My husband, magnesium also made me sick. But we do take calcium. So, hopefully we can head some of that stuff off. More older Americans are keeping their natural teeth than ever before. But there are marked differences by race and socioeconomic status. And I had a tooth break, as you might have noticed, a few years ago. And my insurance plan that I had doesn't cover fixing that. You can go to the dentist once a year, but didn't cover fixing that now. I've got a new plan this year as of January 1st. And, maybe this will cover good. It does have dental, but we're not sure what it covers yet. So, we could go for a visit and see how that goes. And, maybe get my tooth fixed. But it's not a top priority to me. It's just a tooth. It's not going to be around forever anyway. Not that vain. Loss of teeth due to decay or periodontitis, gum disease, often attributable to infrequent dental care, can have serious implications for nutrition. Because if you don't have teeth, you can't eat. And that's something my mother-in-law is going through now. She says she can't eat with her dentures on. But yet they give her food that she can't chew with their dentures out. So it's just a big mess over there. Nutrition plays a part in susceptibility to such chronic illnesses as atherosclerosis, heart disease, and diabetes. Eating fruits and vegetables, especially those rich in vitamin C, citrus fruits and juices, green leafy vegetables, broccoli, cabbage, cauliflower, and Brussels sprouts lowers the risk of stroke. And I had some cherry at breakfast today, and I had carrots and beans and things, for lunch today. So, I've got some in today, and I'm gonna get some lettuce and tomatoes and stuff in later today. So, I'm getting me some real food in. That's the important thing. Get real food in there too. Don't eat just the junk, the crap. Eat some real food too. And that's something, I try to get my son, who doesn't really like real food, but it's like you're supposed to have like 2 servings. We went on this whole diet thing with a dude from India, a cardiologist, and you can have one carby thing, but you have to have one real food. So if you're going to have like a donut at your breakfast, you have an apple also. And if you're going to have like some kind of sandwich or something, with your lunch, then you have, some veggie sticks also. So, not only eat junk, eat real food, go with that. And when I say veggie sticks, I don't mean french fries. Although technically they're a vegetable, but they're also a starch, so, it doesn't really count. Oh my goodness. Vitamin D deficiency increases the risk of hip fracture. So if you don't get enough vitamin D, like I said, we take vitamin D and we do the calcium, so you might fracture your hip. My mother-in-law fell a couple years ago and fractured her hip and had to be in rehab. She got back out and got to go home, but honestly, I don't think she's going home this time because she's not willing to do her rehab. So, mental and behavioral problems. Contrary to common belief, decline in mental health is not typical in late life. However, mental and behavioral disturbances that do occur in older adults can be devastating. Dementia is the general term for physiologically caused cognitive and behavioral decline sufficient to affect daily life. Most dementias are irreversible, but some can be reversed with early diagnosis and treatment. So, if you're concerned that you might be having a form of dementia or Alzheimer's, go to the doctor. Tell them, talk about it. It might be something that can be treated if you get it in time. About 2/3 of causes of dementia may be caused by Alzheimer's disease, a progressive degenerative brain disorder. Parkinson's disease, the second most common disorder involving progressive neurological degeneration, is characterized by tremors, stiffness, slowed movement, and unstable posture. Medications that replenish the brain's supply of the chemical neurotransmitter dopamine can alleviate Parkinson's symptoms. These 2 diseases, together with multi-infarct dementia, which is caused by a series of small strokes, account for at least 8 out of 10 cases of dementia, all irreversible. So those are the ones that can't be treated and fixed. Excuse me. Like say the Parkinson's symptoms, oh my goodness, can be treated, but it's not going to fix it, but it can lessen the symptoms for you. Alzheimer's disease. Alzheimer's disease is one of the most common and most feared terminal illnesses among aging persons in the industrialized world. It gradually robs patients of intelligence, awareness, and even the ability to control their bodily functions, and finally kills them. So we've all known people that have had that, and it's something that it's going to take you down in the end. An estimated 4 million people in the United States have it, and nearly 400,000 new cases are diagnosed each year. Alzheimer's disease generally begins after age 60, and the risk rises dramatically with age. So, the older you get, the more likely you are to end up with Alzheimer's disease. No, that's not what any of us wants to hear, but it's a fact. Symptoms and diagnosis. So far, the only sure diagnosis of Alzheimer's disease depends on analysis of brain tissue. The brain of a person with Alzheimer's disease shows excessive amounts of neurofibrillary tangles, or twisted masses of collapsed protein fibers, and large waxy chunks of amyloid plaque. It's otherwise known as non-functioning tissue formed in the spaces between neurons by an abnormal variant of a protein called beta amyloid. Because of these plaques are insoluble, the brain cannot clear them away. So once they're there, they're there. They may become dense, spread, and destroy surrounding neurons. These changes probably occur to some extent in all aging brains, but are more pronounced in people with Alzheimer's disease. Doctors usually diagnose Alzheimer's disease in a living person through physical, neurological, and memory tests. They will do the scan on the brain to, have a look. And they will take anecdotal evidence from the family, and they will give the person memory tests. My mother-in-law has to do this to see what's going on, as well as detailed interviews with patients and caregivers or close family members. Diagnosis made in this way can be 85% accurate. And like I said, if you got the scan and it shows that, then it's a little more accurate than 85% where you just getting the anecdotal. Mild cognitive impairment, not yet severe enough to interfere with activities of daily life, can be an early sign of Alzheimer's disease. The most prominent early symptom is inability to recall recent events or take in new information. And that is something that, can be disturbing to you, especially if you have a good memory and you're used to that. But now there are cases where I've heard of people who don't remember something that happened 5 seconds ago, and like they can't read something and learn anything new. And, that is scary. A person may repeat questions that were just answered or leave an everyday task unfinished. And, we've noticed that with my mother-in-law. She does that a lot. She asks the same question of you 3 and 4 times in a row. And like I said, she's not wanting to do anything for herself now. She doesn't even want to try and, put her own undies on. So, it's not looking good. These early signs may be overlooked because they look like ordinary forgetfulness or may be interpreted as signs of normal aging. More symptoms follow: irritability, anxiety, depression, and later, delusions, delirium, and wandering. And I've known a few people who had this. And, it always kind of goes this way. And, you try to tell people this is how it's going to go, and they're in denial, or they think you don't know what you're talking about, and then it does go that way, and you're like, I tried to tell you, I'm not trying to be mean about it, but I did try to tell you to be prepared for this, because this is what's going to happen. Long-term memory, judgment, concentration, orientation, and speech all become impaired, and patients have trouble handling activities of daily life. And that's, a thing that is noticeable. And, if your older adults are doing things of this nature, it's time to say, hey, you know what? I see you're having troubles. We need to go talk to the doctor and let's figure out why you're having such trouble with just your life. Skills are lost in about the same order they were originally acquired. So, at some point, you literally reach your apex and then you start going backwards, So, not great news, but it happens a lot. By the end, the patient, like an infant, cannot understand or use language, does not recognize family members, cannot eat without help, cannot control the bowels, and bladder, and loses the ability to walk, sit up, and swallow solid food. Death usually comes within 8 to 10 years, but many occur as long as 20 years after symptoms first appear. And now, the nursing home that I worked in for a couple of years, we had an older lady who'd been there for over 20 years. I think maybe 22 or whatever. But she literally was just laid flat out on the bed. She could not speak. She showed no, cognizance that you were even there. She could not eat by herself. If you put the food in her mouth, she would chew and swallow. If you put a straw in her lips, she would drink. But she was just blank. And, of course, there's no control of any sort. So, everything had to be done for her. And she just lay there in one of those big lounge chairs. Looks like a lazy boy, she got to push around. Because she couldn't sit up, in a wheelchair. So, unfortunately, if you get Alzheimer's disease, or one of the, advancing dementias, that might be how you end up. So, take care of yourself, eat well, exercise, and, if you start noticing things, go to the doctor. Like I said, after my stroke, 33 years ago, I talked to the doctor and it's like, well, yeah, we saw you, but now 2 weeks later you're having a problem. There's nothing we could do about that 2 weeks later. So, because it affected the speech center. And, that's become a problem in my life. It's hard to do speaking and teach when you have to struggle to find words, and sometimes you can't find the exact word you want. It's in the brain, but you can't get it to come out of the brain into the mouth and out. So you have to come up with a similar word. Don't think you don't ever need that, thesaurus, because it might come in handy someday. Put enough words in there, you'll come up with one that's right. And that's where I'm going to leave you for today. I hope this helped you figure out maybe a little bit more about why you do what you do. Please like and share this educational program so we can spread it around the world. Thanks for watching. If you want to help me out, subscribe to my YouTube channel. If you want to help me out even more, go to my Patreon page and become a patron. That's all for now. Until next time.